Hello and welcome to the Swansea Bay Cardiac Rehabilitation Team's presentation on managing weight. Now before we start, I need to share with you the limitations of this presentation today via this disclaimer. This presentation should be used for general information purposes only. It is not a substitute for specific medical advice from a GP, specialist or other healthcare professionals and should not be used as such. For individual cardiac rehabilitation advice, please consult your local cardiac rehabilitation team. If you're experiencing any changes in symptoms, please seek advice from either a GP or a specialist. And in the event of severe chest pain or breathing difficulties, please dial 999. So, this is me. I'm Claire and I'm the psychologist within the team. And within the team, I provide support with making lifestyle changes over the long term and also on managing the emotional impact of cardiac events. When you've had a heart attack or heart surgery, it can take some time for you to just generally come to terms with everything. It's also part of my job to provide some support and education around this. Now, some of you might be wondering why a psychologist is talking about weight management. Well, this is an area where I've got a lot of experience. I've worked within specialist weight management services for 7 years. I'm hoping that you might find some of the information that I'm going to share with you today helpful in your own weight management journey. Now, the focus of this talk is about the actual process of trying to manage or lose weight. There are some other presentations available in terms of managing weight that you might also find helpful, which are making lifestyle changes, setting goals, and activity and exercise. If you're seeking information on healthy eating and a heart-healthy diet, you can find a link to this in the resources section at the end of this presentation. So here's the plan of what we're going to look at in this presentation. We'll look at how being within a certain weight range can reduce your risk of further cardiac events and the reasons for this. We'll look more closely at the factors that can make it a struggle to manage weight effectively. We'll consider some of the things that can help us to manage weight over the long term. And also what to do if the weight loss stops and you can't figure out why. Finally, I'll provide you with some links to resources to help you on your weight management journey. So without further ado, let's have a think about why managing weight can be important in relation to managing a heart condition. Carrying excess weight is a risk factor for heart disease. And the reason for this is because being overweight increases the risk of fatty material building up inside the arteries. We also know that in relation to the build-up of visceral fat, which is the fat that sits around your organs, this raises blood cholesterol and blood pressure, which are themselves risk factors for heart disease. It also increases the risk of developing type 2 diabetes because it prevents your body from being as receptive to the insulin that it produces. Insulin is a hormone that controls blood sugar, and having high levels of sugar in your blood can damage arteries, which also makes diabetes a risk factor for heart disease. So how do you know if losing some weight would be beneficial for your heart health? To decide this, you need to take 2 measurements. The first of these is your body mass index, which is your weight divided by your height squared. You can find a link to an online calculator at the end of this presentation where you can enter your height and your weight and it will calculate your body mass index for you. So no difficult maths involved at all. You can just type in the numbers. The other thing that you need to measure is your waist circumference. And to do this, you will need to take a tape measure and measure your waist around your body. Now, it's really important that you measure this in the correct place, which is halfway between the bottom of your rib cage and the top of your hips. And for most people, this is close to where their belly button is. It's important not to go by the waist size of your trousers, because most men and many women tend to wear their trousers much lower than their actual waist, which is closer to the hip, and it's a different size. Once you've got both of these measurements, make a note of them. If you find that your body mass index is above 25 or above 23, depending on your ethnicity, and your waist circumference is above 94 centimetres or 37 inches for a man, or above 80 centimetres or 31.5 inches for a woman, then it's very likely that your heart health would benefit from losing some weight. So this is maybe something that you might want to pay more attention to and do something about. So on to actually what do we need to do if we're looking to lose weight or maintain weight. Essentially, what we know about how our bodies gain and lose weight is that it's reliant on what we call the energy balance. That is, the energy that we take in versus the energy that we burn off. So if the amount of energy that we take in is essentially about the same as the energy we burn off, our weight stays the same. And I say it stays the same-ish because our weight normally fluctuates from hour to hour, day to day, as part of normal physical processes. So we never stay at exactly the same weight ever, but in principle we stay around the same body weight. Now, by the same logic, if we consistently take in more energy over several days than we burn off, then we will gain weight. And similarly, if we consistently take in less energy on several days than we burn off, then we will lose weight. So let's have a look at why many of us often struggle with losing weight as a process. And to do this, I think about eating as being a line with very restricted eating at one end and conversely, very unrestricted eating at the other. At the very restricted end, what we tend to see is somebody desperately trying to get the weight off and heavily restricting their energy intake, perhaps by following quite a strict diet. At the other end, we see no restriction whatsoever and a tendency to eat despite not really feeling physically hungry anymore. Now, as a psychologist, I tend to see a pattern where people who are struggling to control their weight often engage in a process a bit like this. They tend to flip between two ends of this line, leading their weight to reduce quite quickly and then increase, sometimes leading to a higher weight than they started with. It's so commonly observed that there is a term for this, and it's called weight cycling. More casually, it's often described in the media as yo-yo dieting. It's a normal psychological response for people to crave or desire what they perceive they can't have. So following strict diets or following food rules about good and bad foods often lead to this pattern of eating. Now, what I tend to observe in people who don't really struggle to manage their weight is that their eating tends to be more around this area of the line. And I describe this to people as being in the middle ground. The people who seem to have the most success have a tendency to stay in the middle of the two extreme ends of the line. Now, This isn't to say that those individuals in the middle ground never stray out of the middle ground, but rather when they have, they tend not to stay there for very long, and they move back into the middle rather than to the opposite end of the scale. Now, something that I say to my patients is that if you feel like you're trying to grit your teeth through a change, you're probably only going to keep it up short term. Like in running, you can't expect to complete the marathon if you start it with your sprint. Even the most fit and experienced of runners can't sprint full pelt for 26 miles. And it's the same kind of thing with managing weight. If we're going to make changes that we can keep going over the long term, they have to feel doable and they have to feel comfortable. Almost like in running, we need to be able to pace the choices that we're making to try to manage our weight. If we don't allow ourselves any degree of flexibility to make choices, to incorporate things that we enjoy, our central nervous system does not like this at all. And when we feel like our choices and control are being taken away from us, it normally motivates us to do the exact opposite of what we intend. And it gets us in a bit of a mess in relation to keeping changes going. So what kinds of things can be helpful if you're trying to lose some weight? Firstly, have expectations that are realistic. 1 to 2 kilograms, or around 2 to 4 pounds a month, is a really good and healthy rate of weight loss, and it's a good one to hope for. Just bear in mind that sometimes it might be a bit less than that, other times it may be a bit more. Be open to this and expect it to happen. Sometimes, despite our best efforts, we might not see a change on the scales that week. That doesn't mean that you've failed. There's lots and lots of bodily processes that affect our weight on a given day. That's why it's important to have a look at the trend over time rather than just your weight on a given day. Try to look at your weight over a 6-week period. If the general trend is that it's going down, you probably just need to keep the faith and continue with what you're doing. Next, when you're thinking about reducing your energy intake, think about one small change to your current eating that genuinely fits in with you and your life. Think ahead to what the next step might be if you aren't seeing a downward trend across time. This is something that you'll need to keep going long term, so make sure you don't set out to ban anything that you really enjoy eating. Perhaps think about some of the ways that you could incorporate it into your plan while not sabotaging your progress instead. Be flexible. On some days you'll need to eat more, and on others you'll need to eat less. This is normal. Trust your body to tell you what it needs. Remember that there are no good foods and no bad foods. No food should be completely off limits unless it's a food that makes you unwell in some way. What we do have is how much food, how often, and what type of food. Play around with these and find the combinations that best reduce your energy in a way that suits you. For example, one person may decide that for their regularly enjoyed dinner of pie and chips, they might have a smaller serving of the pie, a small jacket potato, and a larger portion of vegetables. For another, they might decide to keep the chips, add some vegetables or salad, and have a lean cut of meat instead of the pie. It's different for different people. Many people seem to do well with what we describe as the 80-20 rule, making sure that you try to eat in a way that's good for your health and weight friendly for around 80% of the time. There's no one way to do this. Everybody has different preferences. The key to success is finding changes that work for you in the long term. Take time to notice your hunger cues. Learn the signs that your body gives you when you're physically hungry and also when you're satisfied from your food. It's when we ignore these cues that our weight tends to be impacted. The vast majority of people who do not struggle to manage their weight tend to eat intuitively in line with these kinds of cues. You'll find some resources at the end of this presentation to help you develop skills in intuitive eating if that's something that you think you might be interested in. Now, something that's never ceased to amaze me is that people who've struggled the most with their weight tend to be the hardest on themselves of any other group of patients I've ever worked with. One of the things that we're starting to see in research data is that being harsh on yourself when it comes to managing weight just doesn't seem to help people. If things haven't worked out as you planned, it's amazing what a difference this can make if you're simply kind to yourself. This doesn't mean that you simply pretend nothing has gone wrong or that you're permissive to yourself continuing to make unhelpful choices. Rather, it means speaking to yourself like a good friend without hurling insults at yourself or beating yourself up for getting it wrong. That doesn't generally lead people to feel motivated. A more helpful approach might be something like saying, that didn't go very well. What led up to me making that choice, and how can I deal with it differently in the future? Secondly, aim to be curious. Ask yourself, why is it that I'm eating this? If it's not because you're physically hungry, what is it that you're really needing instead? Also, take time to actually enjoy what you're eating. Savour every bite and take a few moments to notice what you enjoy most about that food. Is it the taste, the texture, the smell, how it feels in your tummy? Most importantly, food is meant to be enjoyed. If you're really not enjoying what you're eating, then you need to stop and find something that you do enjoy. Remember that no food is off limits unless it makes you physically unwell in some way, and you can always tweak the amount or type of food to help the energy balance to tip. Finally, remember to monitor your progress. And when I say this, I don't just mean in terms of looking at the outcome on the scales. If you're perhaps looking at reducing your portion sizes of higher energy dense foods such as fats and increasing portions of lower energy dense foods such as vegetables, monitor how well you're maintaining these changes and how easy you're finding it to stick with them. This is because weight loss is the outcome you get as a result of making behaviour changes. It's not the behaviour itself. Some weeks the scale won't move, and it might or it might not be reflective of your changes not working at all. By keeping a record in some way of how well you're keeping your changes going, it can make it easier to understand whether or not further change is necessary. It also lets you know that you're achieving your goals in terms of keeping change going. By looking at the big picture and taking into account things that indicate you're making progress independent of the number on the scales, so things like successfully maintaining a change or feeling healthier or a reduction in your blood pressure or your clothing fitting looser. These things are more likely to encourage us to keep going with changes rather than simply giving up if we find the scale isn't moving at any point. And make sure that you acknowledge your progress, whether that's a reduction in your weight or a non-scale achievement, by rewarding yourself for your hard work in some way. Try to choose activities or things to reward yourself in that don't involve eating or food. Not only might this kind of reward be unhelpful for managing your weight over the long term, it also reinforces the idea that you're going without certain kinds of foods, which can make changes a bit harder to maintain over the long term. Most people at some point reach a plateau where the scale just isn't moving. It happens. Unfortunately, this tends to be the point where people decide that they'll never lose weight, there's no point continuing with the changes, and they're going to give up trying. This is a real shame because quite often this leads to weight regain. So how can you continue to manage your weight if you find yourself facing this barrier? Here are some tips from the field. First of all, keep going with what you're doing for another 4 to 6 weeks. Weight loss naturally fluctuates and it might just shift in time. If the scale seems to be stuck, try introducing another small change after this 6-week period to see if it makes a difference. Remember, it has to be something that you can keep going. And finally, reflect on your progress so far. This is really, really important. Think about how far you've come, how many changes you've made, and how well you're keeping them going. Just because the scale isn't moving at the moment, it doesn't mean that you've failed. And quite often, the weight starts to shift again after a few weeks without the person having to make any further changes at all. Sometimes, just making an extra small change gets the scale moving again. Praise yourself for keeping going despite the scale not moving in the way that you would like it to. So we're coming towards the end of this presentation on managing weight, and I've just included here a few resources that you might find interesting or helpful. First of all, I've got a body mass index calculator here for anyone who would like to calculate their body mass index. You can find one in that BHF link there. I've also got some information here about healthy eating and eating a heart-healthy diet, because this might inform some of the changes that you might like to make to your diet and your eating. I've mentioned a few times during the presentation the process of intuitive eating, responding to our hunger cues and responding to when we're satisfied. Because quite often we've kind of had that beaten out of us from quite a young age, and we've learned very effectively to switch off from our hunger cues. I've included some resources that can help people to kind of re-engage this skill that all of us naturally have. And it helps you to kind of figure out the signs of when you're hungry, when you're full, when to start eating and when to stop eating. So a lot of people find that one quite helpful. And I've listed here some helpful books that people might find useful in their weight management journey. So Health at Every Size is a book that's geared to helping people identify the kinds of small changes they would like to make to their eating and which ones it feels realistic to keep going. The Joy of Half a Cookie is a book on the process of what we call mindful eating, which means really kind of tuning into how we feel about food, what we think about food, and also learning to respond to our bodily cues around eating. The Weight Escape is a fabulous little publication which looks at a number of the different factors that can keep us out of that middle ground on that line of eating that we looked at earlier. Ways to help us to keep ourselves in the middle ground by making changes to how we think and what we do and how we respond to how we feel. So that's quite a good book to look at if you find that you find it really difficult to stay in the middle ground. And finally, I've got the compassionate mind approach to beating overeating. This is particularly good for people who find that they emotionally eat. So if you tend to find that there's a pattern between you overeating or undereating in response to how you're feeling emotionally, and also if you've got a bit of a tendency to be quite harsh on yourself and beat yourself up a bit when things don't go right with managing your weight, this is a great book for you. So thank you very much for your time. I hope that you found this presentation helpful or useful. And if you feel that you'd like some more support with your weight management at all, feel free to contact me by calling the Cardiac Rehabilitation team. If you leave me a message, I'll happily give you a call back. Thank you so much for listening, and goodbye for now.